Hi, I'm Dr. David Huffman. I'm the site director here in Chatham. We're actually really lucky in that we get a lot of residents here who are truly interested in comprehensive family medicine. It's actually great because they get a chance to do shifts in the emergency department, they get a chance to do obstetrics, they get a chance to do family practice, in particular in the second year, all in a longitudinal form. The first year is really sort of block-based, but the second year you really feel like you're the same as your preceptor. It's much more collegial than, and mentorship than it is hierarchical. It's been a really pleasant experience. In fact, our retention's been wonderful because we get to know our residents and often they like to stay. So it really is geared towards complete comprehensive family practice where you get to know, in a smaller setting, where you get to know people, get to know your patients, get to know your colleagues, get to know your preceptors, and it's actually worked out really well over the last 5 years.
I'm Aislinn Pierce. I'm a PGY1 in the Chatham Family Medicine program. One of the great things about being in a smaller community for doing a residency is you get a lot more one-on-one teaching time with staff. That's something that you wouldn't get in a bigger centre like in London or the other bigger centres.
Preceptors are really fortunate in that there's quite a bit of one-on-one experience. You get to know your preceptor and your colleagues and their specialty services in the hospital so that you're given a much better graded responsibility. You certainly are able to do more, see more, and because we know our residents, know them really well, we have a good feel for what they're able to do, what they're capable, and what they're ready to move on to.
I was looking more for like the rural setting, low saturation by other residents and students, first access to, being that sort of junior doctor care provider. That's kind of what I wanted, and then Chatham is kind of handy because of all the services that we have here, so you don't need to travel a lot in order to get exposure to the specialties and other stuff. Our catchment area is big enough that we see a lot of different pathology and people who live in more remote areas of this municipality come in with more advanced disease, and so we get a lot of interesting cases.
Chatham's a great place to live in. As opposed to a bigger centre, you have the opportunity of finishing work at 5 and being home by like 5:02. It's great. Everyone here is so friendly, all the staff in the hospital and the family health teams, and it's been really welcoming and friendly.